what do you think is most misunderstood about cancer?
I think one of the things that's misunderstood is that cancer is a metabolic disease.
Mm-hmm.
I just think the concept is misunderstood.
Mm-hmm.
And its survival depends on its fuel and its
Mm-hmm.
environment.
Mm-hmm.
And that's sort of one of the main things. I think cancer is intelligent. And I think it's important for us to not sit back and think we've got this figured out. I think it's going to find a way to continue to be, and that we need to find a way to continue to learn from that. And so I think that's how I feel about that. And maybe most important is that cancer is not you, right? You have cancer. It's not an identity. It's a process.
Definitely. I agree. I mean, I'm really trying to separate it from me and not embodying it. I don't even like saying the word out loud about myself. And I don't know if that's a protective mechanism or defensive mechanism or reminding myself that I am whole as I am. But I think that's a really good point, especially about it being sneaky and clever.
Hello, friends. Welcome to the Forward Think Tank podcast, a place for sharing stories of hope, inspiration, and wisdom on all things holistic health. I'm your host, Jamie Mazza, a holistic health coach and lifelong dancer. After being diagnosed with a rare thymic tumor and autoimmune disease, I am on a mission to fully, radically heal. Tune in as I share stories from my personal healing journey, interviews with forward thinkers and healers in the wellness industry, and stories from incredible humans who have gone through their own health challenges and continue to move forward in hope. Thanks for tuning in. So grateful you're here. Hello, and welcome back to the Forward Think Tank. This week is very special for a couple of reasons. So one, this is the final episode of season 1 of the podcast. If you've been listening from the beginning, I want to thank you so much for being here with me on this journey. I've brought on so many incredible guests that I'm really proud of, that it was such an honor to sit with and to talk to, and I hope that you learned some things from them and also from me sharing my story here. I am making a personal choice to wrap the season because I am about to undergo a pretty big surgery, as you may have heard me talking about in previous episodes. So this is also a special episode, and I chose to end season 1 with this guest because she is somebody who has just been a true light and guide, wonderful, incredibly brilliant resource for me along this entire journey since my very beginning of the diagnosis in November of 2023. Dr. Janet Maendel is sitting down with me to wrap up season 1. She is incredibly brilliant, resourceful. She has been doing this work for quite some time. And having the opportunity from the very beginning to work with her has been like a breath of fresh air, and honestly, the resource I didn't know that I would need. She has seen me with one eye open. She has seen me at some of my lowest points throughout this year. And so to have her help feel a little lighter with all of the heaviness that has gone on, but also have an action plan and always have a path forward for how we are going to heal and recover from the conventional therapies, as you'll hear us talk about. I really pick her brain in this episode and talk more in detail about other therapies I am doing to coexist and support the metabolic approach. So we'll talk about things like high-dose vitamin C, mistletoe, the Christmas flower helleborus that I nebulize that so many people ask me about, that honestly she can truly speak so eloquently. So just to give you a background on Dr. Janet. Dr. Janet Maendel is a doctor of natural medicine. She's a leading expert in integrative oncology and functional medicine, combining her extensive training with a compassionate, patient-centered approach. Her expertise lies in employing the metabolic approach to cancer, a cutting-edge, evidence-based clinical method designed to address cancer as a metabolic disease. This comprehensive approach utilizes advancement diagnostics, including blood chemistry, genomic analysis, toxicity profiling, hormone assessment, microbiome testing, and more to create a personalized strategy for optimizing therapies, food plans, detoxification protocols, and supplement regimens. Janet's work with the metabolic approach to cancer empowers patients at every stage of their journey, whether as a preventative measure, in conjunction with conventional treatments like chemotherapy, radiation, or surgery, or during post-treatment recovery. By addressing the root cause that contribute to the growth and progression of cancer, Janet's practice focuses on restoring balance and resiliency to the body's metabolic terrain. She's a certified functional medicine practitioner and integrative functional medicine practitioner, a data-driven, systems-based approach that emphasizes understanding and treating the underlying cause of illness and nutrient deficiencies. In addition to her functional medicine credentials, Janet holds a doctoral degree in manual osteopathy, equipping her with advanced expertise in holistic manual therapies. These modalities are used to effectively treat musculoskeletal conditions and injuries while supporting the body's overall structure and functional integrity. Janet's integrative philosophy reflects her commitment to providing scientifically informed, personalized treatment plans tailored to patients' unique needs, fostering healing, balance, and vitality in body, mind, and spirit. Dr. Janet has worked with me one-on-one, personalizing my treatment plan every step of the way. Every month we look at labs together. We change our approach slightly, whether pushing more on the oxidative therapies or pumping the brake, switching up supplement protocols, switching up IV therapies. All of these things together have really helped me feel as good as I have felt this entire year. It was such a gift to sit down and get some time together. I do just want to note that I had made reference to her as a naturopathic oncologist. I do just want to reiterate she is trained in functional medicine and truly an integrative practitioner. So I apologize for interweaving those words and using them so interchangeably because I do understand how they are different. But it was such a blessing to dive a little bit deeper into the spiritual side of things. You'll see as Janet explains her story of how she got into this work that it really was relying on her faith to point her in the right direction. And I do feel with all that I've experienced that it really was a sense of faith and believing in something bigger than me that my husband and I were able to find the metabolic approach to cancer, which then just happened to find us in the hands of Dr. Lori and Dr. Janet. The two of them have been such a gift to me. I think you will see why I just adore Dr. Janet. She, from day one, looked at me as a whole hand. It has been a delight to work with her in a time in my life and on a topic that can feel so heavy and dark. So Dr. Janet, thank you so much. She also talks a bit about immunosine, which is dendritic cell therapy. Stay tuned for the episode. She will share more about that. I will include how to get in touch with her in the episode description below. And I just want to thank you again for tuning in. I will be taking a bit of a break while I recoup from surgery. So if you are catching up on these episodes and find them interesting, please leave a review, comment, share them with a friend. Please, please, please share. I'd love to spread the message of why I initially started this podcast, to inspire people, to help others who may be trying to navigate their way through their healing journey, whether it is with a major health crisis and a diagnosis like this, or maybe something a little bit different, but they're looking for different ways to heal outside of the conventional model and also looking for stories of hope. I brought Tanya Atkin on last week. She was the first person I spoke to on the other side of her cancer diagnosis. And so I hope to be able to share more of those stories in the future. And with your help and your sharing and putting it out there to other people that are outside of my immediate network, we will impact and help other people feel less isolated and alone. So thank you so much for tuning in. I love you all. Please enjoy this episode and welcome Dr. Janet to the Forward Think Tank. Hello, everybody, and welcome back to the Forward Think Tank. This week, I have a very special guest, my naturopathic oncologist, Dr. Janet Maendel. I am so happy to have you here. I don't think I've ever told you this, but in my mind and to like Nick and my family, I call you my fairy god doctor because you're such a comfort to me and you really have dove so deep personally with me from the very first conversation we ever had. It wasn't like, talk to me about the diagnosis. It was tell me about Jamie. Like I want to learn about you. And I know you and I have had so many conversations over this last year plus, and you've just been such a guiding light to me. Thrilled to have you here and, really pick your brain today. So thank you so much.
Oh, you're welcome. It's an absolute pleasure to be here with you.
Thank
So
you.
looking forward to this.
Yeah, me too. I know I brought Dr. Lori on and definitely picked her brain about things. I had similar questions for both of you, but I divided and conquered because there's so much to cover in this world of naturopathic oncology. So let's just dive right in. Tell me about your experience working with cancer patients and helping them heal and what inspired you to get into this work.
My expertise, like my work, is metabolic terrain-based oncology, sometimes known as integrative oncology. And I said that in the intro. But I wanted to sort of start out that it's grounded in the idea, of course, that cancer is not usually a genetic disease, that it's a metabolic disease.
Mm-hmm.
And this, I think, is underlying to sort of everything that I do and how I do it. And so this perspective, of course, views cancer as a systemic condition influenced by the terrains, and then it's very individualized, as you know. And
Yes.
those things that sort of shape what we do and the measures we take and how we test and the next approaches and so on is, I guess, where my expertise lies and also where my work lies overall.
Mm-hmm.
What got me into this is a whole story.
Okay, so maybe that's another podcast.
That's okay. So I didn't want to be here, quite frankly. This was not my plan. I was working as a functional medicine practitioner, certified in functional medicine, and I loved it. And it was within that role that I was getting people who were asking me, I have cancer. Can you help me? Or what can you do? Or can I come see you? Will you do anything different for somebody that has cancer than somebody who doesn't have cancer? And initially, it was sort of a hard no because I was, terrified of the diagnosis as everybody else is.
Yep.
And let me be clear, everybody's scared. That does not study and does not go into this deeply. And so I would just say, I can't do it, or I'm not sure what to do, or I don't know how to do this. Because in our world, when we're learning, when we're training, when we're in school, cancer is a topic. It's a module. It's one of the chapters or 4 of the chapters, or it's a 1 or 2 day thing. Mm-hmm. It's not anything specific. And so I was not disillusioned exactly. I didn't know what to do.
Yeah.
And so I went ahead and I was like, okay, so this kept happening over the years. Every now and then somebody else would ask, and I was like, no, I don't know what to do. And so at one point I decided, okay, I'm going to set up a referral base. And so I wrote out, 20 or maybe 30 emails to functional med experts and to naturopaths and just people I knew of and people I Googled. And, almost everybody that responded back to me said sort of the same thing. I don't work specifically with people with cancer, or I don't do anything different with a person that has a cancer diagnosis.
Interesting.
It's health, and I promote wellness, and I work with them. And some people said, I actually have pretty good results, but it's not specific. And so I found that I was very surprised with that, because I thought that at least in my area, there were a few. Well, there were, but I wasn't talking to them at the time.
Yeah.
And so that sort of went on for some time. I was part of a few communities online that I sort of started asking questions. Some of the doctors I knew were very specific into the cancer world. And I started asking them, where can I train? Like, what do I do? What can I do to help these people? And I still was a little bit hesitant. I still didn't know quite what to do. This is a number of years ago now. And I started praying about it. To me, I just didn't find an easy path, not even easy. I didn't feel like it was something that I wanted to do. I was still sort of digging my heels in, I think, because functional medicine was so much fun.
Yeah, sure.
And so,
not as heavy.
I was still digging my heels in, and I prayed about this for a number of weeks. And I think as time went on, it sort of became clearer to me that this was a path that I needed to go on. This was something that I needed to learn more about. This was something that I needed to put myself in. And I knew it would be something in faith because I wasn't comfortable. It was way out of comfort. And so I did that. Once I had made that decision, in a way, things just fell into place, because then I was given Dr. Nisha Winter's name. I called them and they're like, we're actually opening a training in 3 weeks.
Oh, wow.
Okay. Timing is
look at that divine timing.
Yeah. And so I sort of had that, I want to say, a confirmation of sorts, like that it just all fell into place from then on. I talked to some of the people that had graduated, Tenacious program, and others. I called them. They were all over the world. I called one person in Egypt. I called people in the US and just asked questions. It's like, you did this. What do you think? And everybody was very, very open about pros and the cons and how they're working it. And I felt like it was a good step for me.
Mm-hmm.
And so now, today, I know it's my purpose. I didn't know then. Then it was just faith.
Yeah. I mean,
Here we are.
what a beautiful story. I mean, I, as a patient, can relate to just praying on the right direction and the guidance. And I think the fact that it brought me to the metabolic approach, and it brought you to the metabolic approach, and it brought us to working together, and me to finding Dr. Nasha and all of that. I mean, that is something that I owe to my husband, because while I was in the hospital that very first week in the ER, trying to figure out what was going on, he was praying, and he is very strong in his faith. And he was the one who found cancer fighter Owen, and then found an interview with Lori, and kind of seamlessly put it all in front of me. So the fact that you're sitting here saying a similar thing, and how that guided you to get here to us working together, it's like, wow, very, very divine to me. So thank you for sharing that. Knowing that cancer is not a one size fits all, and it's been very apparent to me in all the conversations we have, how do you go about putting treatment plans together for patients? And I'm sure that's a loaded question.
Well, no, that's okay. Information. I gather all the information that I possibly can. I often will start with the diagnosis, like the cancer itself. I want to know the type. I want to know the stage. I want to see the path reports. I want to see the scans. I want to know what's been done so far and what the outcome was, and then what else has been done and what that outcome was. And so all about the disease itself, the process itself, the diagnosis itself is important. Then I want to also know about the person. The cancer is one thing, but I want to know about the person that has cancer. I want to know about his or her life. I'd like to have a chronological story that starts from birth. How were you born? What was your mom like? Like, I want to know everything, because I promise I can connect it.
Yeah, you can. You can.
And so I want to know who people are outside of the diagnosis. What led them here? What have they been doing? Where have they worked? What have they been exposed to? What's their mental health? What's their journey? What's their trauma? I want all of that. And then lastly, I want testing. Blood work is my test of choice. I like that to be very comprehensive, but I want to know things like we call it terrain testing in our world, but essentially it's, what's the inflammation pattern like? What's the immune system doing right now? What is the balance of the immune system? How is that going? What is the circulation? Where are the metabolics? Where's insulin? Where's sugar? All these factors that can contribute to the cancering process, the disease process going on. And so when I have that, and if I'm lucky, I get some microbiome and some genetic testing and that kind of stuff, some functional testing. And then when I have all of that, I start putting a plan together of what I can see and how and who is presenting in front of me.
Yeah, of course, working with you, I understand all of this, but for people listening who may not be as familiar with the metabolic approach, it's got to be eye-opening, because you go into the conventional world and they don't look at any of those things. They don't ask any questions. They don't dig very deep, at least in my experience, beyond maybe doing some genetic testing or maybe looking at very baseline blood work. But you and I go in so much detail. So can you speak a little bit more about that, about the blood work, and why it's so important to look month after month, and what you're seeing in some of those tests that you might look for that gives indication of what might be going on?
Yeah. So I'll back up a little bit. When you have the conventional world looking at a diagnosis, in fairness to them, they're looking at the cancer, right? And so they will do everything that they can, but the focus is the cancer, right? So we have the chemotherapies, and we have the targeted therapies, and we have immune checkpoint inhibitors, we have surgery, we have all of those tools.
Yeah.
But when you're looking at cancer as a metabolic disease, or cancer as a terrain-based disease, you're looking at the person who has cancer. And so the perspective is completely different. The focus is completely different. I think both are very important, really. There shouldn't be a one or the other, or I'm in this camp or that camp. But I think that when we see the labs and when we do the deep dive, things show us, for example, if we look at just the inflammation pattern of somebody, I test at least 3, if not more, inflammatory markers every month. And I do that not because the snapshot is important. I do that because the trend is important. Pattern is important. If I know someone's inflammatory picture is coming down and it's a little bit healthier and it looks a little bit more normal, then I know that not only is the cancer process not as effective as generating more inflammation, but also the body around, the terrain around the cancer is looking better. And so it's more, in that case, it would be more about, the body having some control, the body having some healing, maybe some stability around the cancer. And that's why I do all the testing. That's why I want to see things monthly. That's why I pivot. As you know, we change things every month if we need to, if things aren't going well.
Yeah. Yeah.
Labs
definitely.
Yeah.
It's been such a learning for me this last year. And I really, as much as I'm not enjoying being in this situation, I'm enjoying learning as we go. And I think you do such a great job at explaining and also at allowing me to understand well beyond some of the medical terminology. And it's like, okay, well, maybe this is why this is happening. This is what we can do about it. I always leave our conversations with an action plan. And as somebody who likes to know like what's coming next and likes to be prepared, it makes me feel really good because it makes me feel like aside from whatever is happening in the conventional world, and as you obviously know, and at times encouraged, even though it may not have been your first choice, there was a time and a place for why we did what we did with the conventional route. And even when we were doing those therapies, there was also a plan in place for how to help me heal from them, recover from them, and bounce back. So I couldn't imagine getting through this last year plus without having this type of care and support. So it really has meant so much to me. I guess in terms, and I'm okay with you sharing, I share pretty openly in this platform because I think it's helpful for people to understand. So when it came to my case, when you reviewed and we had our, first few conversations, I have also the autoimmune piece in place. So in terms of inflammation, there was definitely points in time where the inflammation was quite high. Was there anything that stood out to you when you reviewed my case, or any insights you can share about thymomas themselves, knowing that they are not as common as some of the other diagnoses out there?
Yes, and that would be the first point. More rare. More rare often means that we have less information of what to go off of, right? Less experience overall. I knew from a terrain perspective, I already knew sort of what I would be looking for and what I would be talking to you about, which would have been or was immunity and autoimmunity and potentially toxins. I also knew I would test all the terrains, but that's where I was going to go, right? And then you had sort of this dual diagnosis, which is sort of the same one, but the dual diagnosis of an autoimmune condition at the same time, which sort of cemented what I thought I would find. This dysregulation of the immune system, not knowing what it's doing, not doing it in the right place, but with a thymoma there. And then with your type of thymoma, I also knew that was a little bit more indicated in being associated with things like myasthenia gravis. And so that part made sense. And then for you also, you had a high Ki-67. The size of the tumor was evident. So there was a lot of things, but we had, and with this being rare, we actually had a good foundation in a way to stand on, because we do have testing for these things and we do have tools that we can use specific to the immune system and autoimmunity.
Yeah. Thank God. I mean, so speaking of that, when we had our first conversation and even maybe the first few, because the autoimmune was the only symptom presenting itself, I was coming to you talking like this, couldn't open my eye. I honestly was like, I don't know, am I ever going to be able to use both eyes again? And you ended up prescribing LDN, or low dose naltrexone. So can you speak a little bit more about LDN, why it's used? Maybe one, because I know it can be used for cancering processes, but I also know it can be used for autoimmune. And as somebody who experienced it, within 2 or 3 weeks of taking it, my eye corrected itself. And I now am like, oh my God, I can use both eyes again.
Yeah. Okay. So I'll start with naltrexone, which is the actual drug. So naltrexone at standard doses, which in our world are very high, but naltrexone at standard doses has been used in medicine for a long time. And it's usually used in people with opioid dependence
Yes.
Sometimes with alcohol dependence as well. And it binds, when somebody takes it, it binds to two types of opioid receptors. So the point of giving it to somebody that you're sort of trying to get off of the medication is that the medication, when they take opioids, they won't have the same effect. And so because naltrexone has already bound to those receptors. Okay, so that's the reason we have it. Now, at very low doses, there's only a partial bond that happens. And that's a short term. And then we have what's called a rebound response or rebound effect. That is where the magic lies, because what happens in the rebound effect or the rebound response is that inflammation lowers and the immune system is modulated. So modulating means there's no great stimulatory effect and no great suppression. So it's more of a modulator. And so that's why we use it. So for you specifically with the MG, there was the idea, of course, of number one, inflammation. And we know that because we had labs and, the symptoms were there. So we had the inflammation, and I knew that naltrexone at low doses would lower inflammation. So because that's one of the things that it actually does. But I also knew that it may modulate immunity. And so same goes in the cancer world, where we have the same type of pattern of the immune system not doing what it's supposed to be doing. Which is true in all cancer cases, by the way. There's always an immune terrain, no matter which way you look at it. It just is. So in that piece, it's also used, but just for the inflammatory piece. So both of them, for you, it was like a 1-2 punch. There's, you have both going on at the same time. So
Lucky
it makes
me.
sense.
Thank you. Yeah, I mean, my mind is still blown. Like, even you explaining that, it still is just like, wow, there was so many, like the first few days, I'm like, okay, like I got it from the compounding pharmacy. I started it. Like, is it going to work? And, to watch the progression. And a lot of people maybe don't know this, but my eye, it was like a total like freak thing to not have control of your body like that. Like my eye was actually like wandering out at one point, which is why I closed it. And then it was also causing double vision, of course, because my eyes weren't like focusing. So to watch that progression, and I now look back at like, my Time Hop app and like see some of the pictures of it slowly correcting itself. It was really amazing to witness that change. And I'm so grateful for it in addition to so many other things that we decided to do. And I want to talk about some of the other therapies. But I think, because I'm sure you're going to have a really beautiful answer to this question. And I feel like this also kind of tested all throughout the year with like all of my setbacks, which you walked kind of alongside with me and worked through them with me. I think my faith was definitely tested many times throughout this experience. So I am curious to hear from you. One, did you see a commonality in patients who go into, and I'm going to use the word remission, but I actually had my first interview yesterday with somebody who got on the other side of their diagnosis, and they're like, I don't even like to use the term remission because it's kind of just like a waiting period where you're in limbo, like waiting for it to come back. I was like, ooh, I love that. So do you see a commonality in patients who get to the other side of their healing journey? And what role do you feel like faith and spirituality, knowing that you, of course, yourself have a strong foundation faith, what type of role do you think that can play in a healing process?
I think the role can be huge, because for me, faith in God reminds me of my place here. How maybe small, right, in the grand scheme of things, but still significant in where I am.
Yeah.
And in a sense, I'm passing through here, just like you are. Right? Just like we all are. And we're all called to something, right? We're all called to something, a legacy, not about money, not about fame, not about anything that, maybe the world, I'm going to say, sees as important. It's about how we reach out. It's about what we leave here, what we do while we are here.
Absolutely.
And yet, at the same time, we're all known by God. And so that, to me, means that every individual is important as their individual being, like who you are. And as you know, I see medicine like that too. Like everybody is individual. Everybody has that thing that we need to find, or things maybe. And I see that a cancer diagnosis, I see this a lot, will often result in a person looking beyond themselves and looking for deeper, not only deeper within, but for something greater than themselves. And I think that maybe most of the time, I'm going to say, that looking is to find hope that none of us, nobody here on earth can actually give them.
Mm-hmm.
We only have what we have. It's still not hope. It's not hope of life. It's not hope of cure. It's not that kind of hope, but that's what people are looking for. And I think it can, and like I said, a cancer diagnosis will often lead people to that.
Mm-hmm.
And I do believe that, healing comes from hope, right? I don't believe there is any healing without hope. Hope comes from faith. Faith comes from God. And so to me, it's just all connected. And you mentioned radical remission. Kelly Turner's book.
I love that book. It was
You
one
love
of
it?
the first books I read when I got diagnosed because it was recommended to me by so many people. And talk about that feeling of hope. It was exactly what I needed at that time. It's like, these people with all different types of diagnosis and, different stages, a lot of them late stage and a lot of them nothing else worked. And they have similarities connecting them, but then all different unique stories as to what helped them to get into that radical remission. And it was so beautiful and inspiring for me as somebody who felt that kind of like shake on the shoulder from God or my angels or whoever at the very beginning, being like, yeah, this is going to suck, but you're going to get through this. And then, you're going to talk about it. And so I'm just kind of rolling with that. But that book, it was such a needed bright light to see what's possible in the healing process.
Yeah. And is it really radical? And is it really remission? Like you just said.
Right.
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 Maybe not the best title if we look back, but same thing. Like there was this commonality between the people that she was talking to and that were reporting to her, like this sort of this commonality of community, this commonality of faith, this commonality of believing in something bigger than themselves.
Mm-hmm.
And I know that perspective alone gives the cancer cell very little power, right?
Mm. Yeah. You hear that?
Yeah, you hear that?
I feel like I was also guided to this new surgeon that we're working with. And when I tell you, like I said, Nick maybe has a little bit stronger faith than I do, but he always loves being part of the conversations that we have in my healing plan. And then finding this new surgeon who is like a 180 in bedside manner, who unfortunately has been through some experience himself with his wife. When we went to meet him in person, he hugged me. He like shook Nick's hand and like hugged him too. And he's like, I've been praying for you. That meant so much to me. I was just like, God, like, thank you. He's like, I hear you. I'm going to go in and take out as much as I can without doing any harm to you. He's also, I felt, seeing me as a human being, seeing me as Jamie. And you know what he said to me when we left the conversation? He put his hand on my shoulder. He said, I think you're going to be just fine on the other side of this. And then you're going to share your story. I was like, did you know that I started a podcast? He was like, oh, no way. That's great. I don't know, just those little like synchronicities and also knowing that people are rooting for me. It's just, I think that is what it's about too, because I think going through this type of experience as a patient, it can feel so isolating and it can feel like you're so alone and you don't want to talk to people about it. But I think for whatever odd reason, all the more reason why I want to have these conversations, because there's so much more to the process. There's so much more to strategizing how you would go about this healing journey by working with people like you. And it's been such a huge tool in my toolkit and a big sense of comfort. So thank you.
You're welcome. You're welcome.
Okay. I know I have so many questions for you. I want to speak to a little bit more about high dose, like some of the therapies that I have done over the last year. High dose vitamin C and hyperbaric oxygen. Can you talk a little bit more about those and how they can help the healing process?
Yeah. Okay. So vitamin C, IV vitamin C. We're going to discuss low and high dose, I think, because there's controversies in all of this. Sure. And there's nuances, as you know. Now I'm seeing her and she changed dose again. So I'll speak specifically about that because I think people generally sort of know about IVC. So when I'm looking at you or anybody else, I'm looking at your oxidation versus your antioxidation. So where is the body in the balance of your oxidative stress, right? I use labs for that, but also how you're feeling and all of that. So when we have this imbalance, so if we have too much oxidative stress going on, it means that the body is unable to clean up. It's unable to get rid of the free radicals that are sort of building up, accumulating. And what happens is oxidative stress, as we know it, is really quite damaging to cancer cells, but also damaging to normal cells, to healthy cells. And in a way, even carcinogenic in it, because we have a perfectly healthy cell. When we have lots of oxidative stress on it, it can actually sort of malfunction and not work well. And so then we get damage, right? And so there should always be this assessment of, we call it aerobic, dysaerobic, or oxidative stress or non-oxidative stress. There should always be the assessment. Now, here's where IVC comes in. IVC, intravenous vitamin C at low doses, is an antioxidant. IVC in high doses is a pro-oxidant. So we can use it in a very nuanced fashion at a specific time, place, dosing, and person. So depending on what's going on, it's generally controversial in the sense that people don't like using IVC within a chemotherapy or within a standard of care therapy or with radiation and so on. But the thing is, it can be used in a different kind of dose where it's synergistic. So when used in, for example, in high doses, in connection or synergized with chemotherapy, it can actually help chemotherapy, right? It can actually potentiate the treatment itself. And so one of the main things to remember with the IVC is just when we do it, how long we do it, and then of course testing to see how it's being done and how the person is reacting to it. All of that needs to be brought into perspective and brought into conversation. I think every month, but people might agree with my timing. I think every month because it does change. And when we push too hard, because like I said, in high doses, it's cytotoxic. So when we're pushing too hard at the cytotoxic realm, we're also damaging body. So we need to know when to back off and allow healing and restoration to take place or balance to be restored a little bit so that we can, push again. So it's the famous press pulse method using IVC, right?
Yeah. I think that's such a good point to make because I know there were times, like, especially in the beginning where I was very new to all of this. I was like, yeah, let's just go at it. I'm going to do everything. And I was getting into a really high level of ketosis. And then I was going into the hyperbaric chamber and doing the high dose vitamin C and doing it all at once and, as much of it as I could tolerate. And then I started to feel like I needed a nap in the middle of the day. And I remember having that conversation with you and you're like, okay, maybe this is too much. Let's back off. And in my mind, I was like, no, we can't back off because we're not going to, do what we need to do to fight. Don't like to use the word fight, but to push on this thing. And then I realized that as you're explaining, there is a reason why you would back off of it to allow your body to not get damaged unnecessarily, I guess, to say it very say it very
to recoup it
generically.
And what was the other one?
Hyperbaric oxygen.
Hyperbaric. So when I think HBOT or hyperbaric, I think of two things: oxygen and blood circulation. And that's sort of what we're trying to do with hyperbaric. So first of all, it's a treatment in which pure oxygen or room air oxygen is used in a pressurized state. And so what happens when we have somebody in HBOT, the increased pressure in the chamber allows oxygen to dissolve more efficiently into the bloodstream and reach tissues that are generally low oxygen state, so more hypoxic. Okay. So within cancer, in the world of cancer, the tumor microenvironment where the cancer is generally pretty hypoxic. That's the one thing about cancer as a metabolic disease is that it can actually create energy if there's oxygen around and it just stays in its hypoxic state and does it there. And so it's our way of trying to get oxygen to the area. So sort of to interrupt that microenvironment around the tumor. But then there's also circulation. We know that because of how the oxygen is flowing through the veins in a pressurized state, that improves circulation. We know that in some people, the circulation terrain or the, blood circulation terrain is one of the main things that we have to deal with as far as what's part of the fabric of this person, what's part of the cause of this issue going on. And HBOT, and there's still timing with this one, as you know, too much, too little, in proper person and time and place can be very helpful.
Yeah, I mean, I actually ended up renting a chamber. It's disguised behind me. I guess we can't really see it in this window, but having that, knowing that the recommendation was to go into it fasted, yes, I guess, but more so like when my ketones were at a certain range in order for it to be impactful. It got to the point where I was like trying to go somewhere into the city, and then the stress of traveling there would bump me out of ketosis. So it was helpful to have the chamber here at home. Then it could just be something that I enjoy, meditate, or just play some like really comforting music while I was in there. And it became something that I could enjoy outside of like all the other therapies, which sometimes when you're going intravenously, it can just be so invasive and not enjoyable. I guess while we're on the therapies, the two other things on my list, if you feel compelled to speak about them, I think they would be really helpful for people to get insights around, because I'm always talking about them. Mistletoe. And then so many people were like, oh, can you talk to me about like the Helleborus flower and why you're doing that? And I was like, I could tell you a little bit about it, but I think this would be better articulated from one of my doctors. So can you speak to those? And I know with mistletoe, I'm sure there's a lot to say. But yeah, any information or insights around those therapies and maybe why they would be recommended to somebody and how they're helpful would be awesome.
So, okay, mistletoe is from the anthroposophical medicine world, and so is Helleborus, actually. Also still pretty individualized. So mistletoe type, that means whatever host tree is chosen, is still supposed to be not just about the cancer type, but also about the person, how they look, how they present themselves, how they feel. So it's really also pretty individualized. It reminds me a little bit about the, more homeopathic type of a bend to it. And it's used, first of all, our world in North America is much less familiar with mistletoe than other parts of the world who use it, right in hospitals. So very common there for cancer. And it's used primarily for two things that I'm going to talk about.
If you are listening to this episode and thinking, I have a serious healthcare diagnosis, I've been dealt the cancer card, I want to have help and support around ways that I can heal myself naturally using naturopathic healing, and I need somebody who gets it, please take advantage of this opportunity to work with my naturopath, Dr. Lori Bouchard. Dr. Lori was nice enough to offer a free 30-minute strategy call to dive deep into your personal needs, understand a little bit more about your unique diagnosis, and see how she could help. So if you have been listening to my episodes, maybe you sat down and listened to my interview with Dr. Lori recently, we talk about cancer as a metabolic disease. And so that really, when you look at it from that lens, you need to work on your metabolic health, whether that is focusing on your nutrition, focusing on certain things in fitness, maybe fine-tuning your supplements, working on, the mental health healing process. This is all encompassing and something you'll learn in the Metabolic Cancer Reset program. So this program is designed by Dr. Lori. It is an incredible program where not only do you get one-on-one time with her, you dive deep into your lab work that you look at in a very specific naturopathic lens on a monthly basis, but you also get access to her weekly group calls. So it is a great way to have resources, connect with other people who are going through something similar and who can only understand what you're going through and, just share their own personal experience, but you also get a program with Dr. Lori. So in her Metabolic Cancer Reset program, she provides multiple videos talking about getting into ketosis, talking about nutrition, talking about fasting, talking about, different ways to even work with the conventional side of treatment. So if this is something you're interested in, or maybe you're listening thinking, I really want to send this information to a friend, to a coworker, a family member, a significant other, somebody else who may be dealing with a significant healthcare diagnosis of their own and they're looking to get support on their healing journey, Dr. Lori is providing a free 30-minute strategy call. So take a look at the description of this episode. I will link it below. Free 30-minute strategy call with Dr. Lori. I promise it will change the game in terms of your healing process. So I hope you enjoy, and thank you, Dr. Lori, for that gracious offer.
One is just that it's a warming therapy. Cancer is known as this cold disease. Mistletoe brings warmth to that. And that's one of the reasons it's implemented in the cancer world. It's also very immune modulating. So we can see many times a shift in the immune system, be it a neutrophil to lymphocyte ratio that shows us how the immune system is doing. Sometimes it helps with overall cell counts. How is the immune system responding to something? So that's where the warming therapies and the immune modulatory properties of mistletoe are the main reasons we use it. Helleborus, also a staple here, but much less well known. It's the Christmas rose.
Which I love.
And it has glycosides like other herbals that we use, like ginseng has them, licorice has them, horse chestnut, aloe, willow. These herbals and these plants are generally known for the properties of also supporting immunity, lowering inflammation. It's used in cardiovascular health, which is cool, and cancer. And in this world, we were nebulizing it, right? And we were nebulizing it because a lot of the information that we have on Helleborus was done through the study of lung function or poor lung function and COPD and pneumonia. That's actually where it was mostly used. And so I'm just sort of combining the two. There's lung function issues and cancer going on. One of the interesting things that I like, and I can't explain this one, is that occasionally people that use Helleborus feel a shift or a change in how they feel about their cancer diagnosis, a relationship to the cancer. So they will report a quality of life that wasn't there before. They will report that they feel different about their diagnosis and where they are. And that's irrespective of what's going on with the cancer part.
Interesting.
And so I find that just amazing. And I really don't know why.
I'm like, is there some sort of like neurological connection? Is it like doing something with your dopamine or like serotonin? I mean, I don't know, changing like the neurochemistry of your brain. Who knows? That's so interesting.
I don't know. It's just, I find it interesting. And I always sort of ask that kind of question, how do you feel? Have you changed, or how do you feel about your quality of life? And it does come up more and more, especially when I ask, because sometimes you don't remember your quality of life from a month ago if it's better.
I mean, I think I had maybe like messaged you on the side being like, should we start Helleborus? Because the nurse practitioner here who gives me my IVs, she actually like put it in my ear. She's like, oh, you're after the MG crisis. She's like, you should do Helleborus, like check with your doctor and see if she agrees. And I asked you and you were like, if you can get access to it, yes. Yeah. And then I was like, okay, what is a nebulizer? Like I was just like, what is going on? But I was having such a hard time. That was like one of the scariest points of this whole year. Such a hard time breathing. And I was willing to do absolutely anything to help. So I noticed almost an immediate sense of relief. But I think generally I've had a pretty good like mental outlook somehow on this whole experience. But yeah, the last like couple months I started that, and then, things fell into place with consulting with this new surgeon. And so I feel like there's such a weight of pressure off my shoulders where I don't feel as nervous about going into surgery as I did. And I think that's like multifactorial, but I'm like, I don't know, maybe the Helleborus did have an impact, and I'm here for it. I'm happy. So that's a really interesting tidbit of information.
Yeah. I don't know. I can't explain it. I just see it. It's one of those things.
Yeah.
Yeah.
So interesting. I mean, I guess some of those things you just can't explain. You have to feel, and you have to like know that it's right. And obviously it made sense for me knowing what is happening with like the lung activity and everything. And so I almost don't even want to throw this question in because I feel like this conversation has been so like nice and light and like talking about all like the naturopathic stuff. I know how you feel about it, so I will appreciate the response to this question because I was on the same page. Knowing that from your lens, there's a time and a place for the conventional and the world of naturopathic oncology to work together. Obviously, you had more of like a medical understanding of why there was a time and a place trying chemotherapy. And in my case, looking at that Ki-67 percentage, which was also a really interesting bit of information. It was not something that anybody talked about in terms of, my conventional team. But when I asked for it, they knew exactly what it was. So I was kind of like, why didn't you look at this? It was recommended by you to look at that early on. We saw that number was high, which indicated there was a high level of proliferation in the cells, from my understanding. What were some of the other reasons, perhaps, that we came to a collective decision to try the chemotherapy?
Well, so integrative oncology, even integrative metabolic oncology, is still about having the knowledge of what tools to use and when. Right. And I think chemotherapy falls into this realm very well. And I do, as you know, I do think there's a time and a place. I think it's nuanced. I think people are all different. And I always want everybody to have an oncologist on board who makes these decisions, who makes the primary decisions, who can do the follow-up, can do the prescribing. It's very important. Ideally, I would want a group of people, this care team for every person. And I know it doesn't exist for a lot of people, which is very sad. But that's what I think everybody needs. And this is why. You are an example of why. Mm-hmm. So in your case, the Ki-67 was a piece of it, because we knew that should the tumor, the cancer cells, be allowed to do whatever they want to do, they can do it very quickly. So we knew that. And for you specifically, the fact that you had, little to no growth in all of that time doing almost all metabolic therapies is very impressive. It's impressive because of what was already there when we showed up, when you finally got diagnosed. So you, I think, are an example of someone who's managed terrain to the point of, stabilizing all of this. And I think that's important here. Mm-hmm. Because adding a chemotherapy when the management of the terrain is not there is also a little bit more shifty, right? Then that's a little bit more difficult, because what's the body going to do with a treatment that's toxic and everything we know about it? So Ki-67 was one. The second thing that was really, really important, and I think probably most important for you, was how the cancer itself was impacting function. In your case, it was breathing. Okay. So it's important that you breathe. It's important that you breathe well. And so I felt like that the decisions need to be made and that discussions need to be had, because now we have symptoms and we have processes going on that are affecting other parts of the body, that are affecting another organ, that are affecting another function. That's, a really important one in your case. So I found that to be the main reason in your case. In other cases, I would also add that metabolic therapies take time. Mm-hmm. And sometimes, or oftentimes, cancer burden is so high that it feels like it's running away with everything. And we just don't have time quite yet for the therapy, the metabolics to take place, for the terrain to be cleaned up, because we do need time for that. Mm-hmm. And I think in that scenario, there's also a time and place to maybe reduce cancer burden so that other treatments can be done or other therapies can be done. Yeah. And so it's nuanced here with chemotherapy as well.
Yeah. It's not like you were saying, okay, as my oncologist said, let's blast this thing. It's like, what? Word choice is so important to me. I was just like cringe. But he was willing, with your suggestions and recommendations and guidance, he was very cooperative and willing to reduce my dosage. So I don't know that initially the dose I did was quite at all fractionated, but can you explain or elaborate a little bit more on why doing more of a low dose chemo might be better received on the body versus a higher dose, or even why it could be more effective maybe in some cases?
Well, for me, it sort of also just comes back to where is the body in the state of balance, right? Mm-hmm. So if we have somebody who, because of where they're at, not just the cancer, but where the body is at, where the treatments are at, where everything is at, they're not recovering. They're very, very weak. They're maybe throwing up. Their cell counts are very low. So when we see patterns of non-recovery, then I would hope that at least the discussion can be had of, can we just turn this down a little bit so that the person has a chance to recover? Oncologists just do that, but not all of them do. And I guess it's there's differences between how doctors treat people, obviously. I think at the end of the day, everybody just wants to get rid of cancer. And to me, it's my role sometimes to just say like, hey, body's here. Wait, the body's here too. Yeah. And I think that tends to be forgotten. Lower doses are less known, mostly because they're not studied as much. So there is not as much information. Generally, what we see is that there's fewer side effects. People tend to do better as far as, what they're able to do. They tend to do better with recovery. The flip side is that often they need to be on chemotherapy for longer because it is a lower dose. So it's not really killing off as much as, a higher dose would. So it's trying to find that balance and hopefully not need to go up, but then you can always go up if you need to go up. right? And so it's just, to me, that makes sense.
Yeah, makes sense for sure. I do want to make sure we have a little bit of time for you to talk about immunosign. I know very little about it. I know very little about the dendritic cell treatment. I've heard bits and pieces about it. So I would love to give you the floor to talk about it, because I have had a couple people that I've connected with different types of diagnoses of their own bring that up to me. Either they were thinking about it, or it was a topic of conversation in one of the calls on Tuesdays. Like, how could it be beneficial? What is it? Like, who does it work for? So I just threw like 5 questions at you at once. But if you can tell us a little bit more about immunosign and how it could be beneficial for somebody, would love for you to share a little bit more about that.
Okay, so Immunocene Cancer Center is a clinic and lab in Cancun, Mexico, and they offer double-loaded dendritic cell therapy to cancer patients, and I'll explain what that is.
Yes,
so I'm working on the medical team there and doing basically the same work I do with you. It's just different demographic of people. And so when we think dendritic cells are part of our immune system, and they are like the bosses, like the generals of the immune system. And they tell the rest of the immune system what to do. So they need to be educated in what we're talking about is cancer. So they would need to be educated that there is cancer going on, that there's cancer cells here, that the immune system should be doing something about this, right? And this is a sort of the similar pathway that dendritics take, when there's a virus or anything like that. So it's not just cancer that this process takes place. Now, when there is a cancer diagnosis, already there, the immune system isn't functioning very well. Like, it's not seeing what's going on. Like, part of the issue, part of the hallmarks of a cancer is the loss of surveillance, right? The immune system isn't seeing what it's supposed to be seeing. And so dendritic cell therapy is the changing of that. It's the education of the dendritic cells. That is what it's supposed to be doing, or what it is doing. So at Immunocene in Cancun, the treatment starts with a biopsy. So removing some cancerous tissue from a tumor. So there has to be a tumor present. And then taking some blood and taking out dendritic cells from the blood of the person. And the biopsy gets sort of broken down into its building blocks, which is proteins and RNA particles and stuff like that. And then the cancer building blocks are introduced to the dendritic cells in like a double-loaded pattern. We call it double loading, and I can explain that. And so it gets introduced to the dendritic cells, and this, like a medicine, gets created in a lab. So this is a very high-end lab. It takes about a week to create this medicine. And then this gets infused back into the patient with now educated, activated dendritic cells of the patient with their own cancer. So very, very individualized. There's only one specific medication or one specific dendritic cell therapy goes for that one specific person. So I like it because it's very individualized.
Yeah.
There are no toxins or stuff like that added to the cells. So I like it that it's all natural as well. Okay. And so when we have that happening, the activation of the dendritic cells sort of activates the immune system. So people will often feel like they can feel fluey. They can feel like they have, their immune system is fighting something. Sometimes there's pain in the tumor area. Sometimes there's pseudoprogression. It looks like the tumors are getting a little bit bigger because there's the infusion of the immune cells. So ultimately, it's the fixing of what nature's not doing. Right? So yeah, that's what Immunocene's doing. That's what we're doing at Immunocene.
So interesting. How long have they been doing that? Is this really new?
So the study of using dendritic cells in cancer is old. It's, I want to say decades. I think 20, maybe not that, but it's decades old. Mostly people gave up on it because it wasn't working very well. And so the scientists who are at Immunocene now sort of continued with that until it worked. Now, in the US, there are now 4 FDA trials going with this very specific treatment and how it's done in this lab, which is why it can't actually be offered in the States, because your laws are, when something is in trial, you can't actually offer it outside the trial. And so that's why it's offered in Mexico at this point, with great hopes that it will be standard of care one day when they finally come to where we're sitting, which is, this works. So get on this. So
is it a one-time treatment? Am I understanding that correctly? Or is it something that takes like multiple courses?
It takes so the initial treatment is like a 6-week event. The patient does not have to stay in Cancun for the full 6 weeks, but they get 3 infusions or inoculations, whatever you want to call them, 2 weeks apart. So around week 2, around week 4, and around week 6. Okay. And then if we can, we'll have some boosters from the tissue stored that can be used in the future. The first part of the Cancun visit is, my terrain labs. So, big panel of labs. They'll do a CT scan just to do it like sort of a baseline, like a prior scan. They'll do the biopsy. They'll do apheresis, which is a medication that sort of gets you to make a lot of white blood cells. That's so that they can take them out. And then at about week 2, once the dendritics are activated and created in the lab, around week 2 is when the first injection happens. A lot of times people will go home in between week 2 and week 4 because they don't actually have to be there. It's sort of person's choice. They'll come back.
Who wouldn't want to stay in Cancun for 6 weeks? Sounds great to me.
I know. So some people go, some people stay, but it's, the timeline generally stays about the same.
Okay.
Everybody.
Gotcha.
So it's a 6-week event. Yeah.
Now, are there certain people that would be better qualified for this type of therapy and certain people that maybe it wouldn't be right for?
So it has to, the person has to have a tumor. There has to be a place to biopsy.
Okay.
So there has to be a tumor. It has to be a certain size in order to get a biopsy, right? So it can't be so tiny that they can't get anything. People need to be able to travel. People need to be healthy enough for a massive immune type of a treatment. So sometimes when people are barely getting off the couch, like they're just really, really, really sick, it's not recommended that they do that because it's really a big boost to the immune system, right? Yeah. The medical team does the evaluation and the approval process, the medical team in Cancun. And they're very, very strict and very, very stringent. So most people still get denied for various reasons. So out of, I think our numbers are still something like 85% do not get approved.
Wow.
So it's still pretty high.
I mean, I honestly respect that. Just knowing the very little that I know so far, saying something can be a cure-all to anybody. It's like, of course, there should be qualifications and it should make sense for you. Yeah. I don't know if I'm maybe confusing the two because this does obviously sound like it's an immune therapy. I mean, it's a heavy involvement of the immune system. Yeah. I know when I did the DATAR test and they looked at different chemotherapies and then off-label drugs and then more of IVs and like supplement things. I don't know if I'm like mixing information up, so please correct me. But I feel like there was a conversation around like immune therapy not being a good fit for me or like indication that it maybe wouldn't work as well. So would that be like a similar thought process to something like the dendritic therapy, or am I totally misunderstanding?
No. So the DATAR test is a blood test. So taking peripheral blood. So it's not a biopsy. So not the same thing. Actionable, but not the same thing. When the blood test of the DATAR does not have an actionable target that it can say, for example, may have said that you're not EGFR positive, or you might be VEGF positive, or whatever. So if they don't have a target, then they'll say, okay, there's no immune target. So there's no medication that we can target this thing. There's no targeted therapy. Okay. It's not even an immune one. There's no targeted therapy for this thing because you don't have this target, or you have it, but we don't have medication for it.
Gotcha.
That's what that was. Okay. Whereas a dendritic cell therapy is about the immune system.
Yeah.
Overall, it's not about any targets. Except cancer. It's not about any specific targets. One of the things that we know that this does very, very effectively is your Th1. Th1 is like T helper 1 is part of the immune system that tends to be lowered, or we think lowered response in cancer. And so those are some of the things. It's just the balance of the immune system and the initiating and activating and education of the immune system is what's going on.
Okay. Theoretically, I would assume that this could also help autoimmune issues. Potentially, or not necessarily.
Potentially and not necessarily is right. So when autoimmunity is very, very active, the person would not get approved until that's at least under some sort of a control. Okay. Because when you have the immune system running away with something, we don't want to do anything that might activate it, right? And so that would have to be sort of stabilized. And it doesn't mean that someone with an autoimmune condition cannot get it, but it would have to be a managed autoimmunity. So we have numbers and we do testing for that.
Gotcha. Okay. I mean, that was like my next question. So in my experience in working with you, we're always testing, looking at labs each month. So what does the testing post-therapy look like? How do you keep an eye on it? And how are you looking at how effective it might be?
So post-therapy in my role looks very similar to what I do with you.
Okay.
The full lab, it's just very immune centric, right?
Gotcha.
Because now the immune system is doing all sorts of stuff. So there are perspectives or lenses through which I look at the labs, right? Because I know the immune cells are going to do something different. I know there might be some blowback for doing a biopsy, things like that. So I know those things and I expect them. And so I look at through that lens. But ultimately, it's still about where the person is, how healthy they are, where the terrain is post anything, like post-surgery, post-chemo. But this is different. It's a different lens.
Yeah. Do you think, obviously, people are going to Cancun to get the treatment? I don't know if you can speak to this or if it's something like you recommend people just look into. It wouldn't be covered by insurances, I'm assuming. So it's like an out-of-pocket expense. Is it an expensive therapy? Can you speak to that?
Yes, it's expensive. I think the cost is somewhere around $100,000 now.
Wow.
Yeah.
Canadian dollars or US? Because maybe that would make a difference.
It would, but it's US. It wouldn't make a difference, but it's US.
Wow. Okay.
Yeah.
Okay.
Yeah.
And I don't know if you mentioned this, I'm sorry, but how long have you been working with them?
I think we started talking last year, early last year.
Okay.
Yeah.
Okay. I imagine you're seeing promising results with the patients you've worked with.
I'm very excited with what we're seeing.
Okay.
Very excited. It's in a way, it's early years. Like I said before, the science is not early. Science has been here for a while.
Yeah.
But the establishment of an actual, clinic is not that old. Like Immunosine itself in Cancun is not that old. It's only a couple years old. And so we're able to sort of start seeing more and more what's going on, what the trends are looking like and how people are doing better and all of that. So it's really exciting.
Any advancements like that, or in any therapies where there's not like a huge blow from like what feels like chemical warfare in your body from all the drugs, you want to make sure you're right for it. So I'm glad to hear that there's like a lot of like vetting and conversation going on before it's administered. But to do something like that where there's not a lot of pharmaceutical drugs involved and it is more of, I don't know that I would call it a natural therapy. I'm not sure exactly what you'd classify it as, but I am able to grow a money tree in my backyard and pluck it and, share it with people. I'm so curious to keep in touch with you on that and continue to learn more about that therapy because it sounds really promising and very interesting.
Yeah, it is. It is.
Do you feel like we left anything out of that conversation? Is there anything you'd want to add?
I don't know. No, I feel like we covered everything. I like how well it synergizes with metabolic therapies. I think that's the goal.
Right.
Because to me, it's still a monotherapy. And they also won't say, this fixes everything. Because of course, it fixes just the immune system, which is still big. So for how I'm looking at it and how I'm approaching it is also sort of that this is the terrain that we are, working on, that we're fixing, that we're educating. There's still the rest of the person here. And so there is still work and there is still, cancer is still here. It's just that we now have the immune system actually seeing it. That's the difference. Yeah. And so for me, I like the synergism of it, but I also like that it's very individualized and that sort of speaks to my heart. It speaks to everything that I do anyway.
Well, I'll be sure if I don't have it already to include some links as to how to explore that therapy, how to learn more about it, and of course, how to get in touch with you if there are any questions. So I'm glad that you added that to the list because I think that's a very interesting thing for people to know about who may not have ever heard of it. So thank you. We'll just do like 2 little closing questions. What do you think is most misunderstood about cancer? What do you wish people knew about it? Maybe on the flip side.
I think one of the things that's misunderstood in that we hear it a lot in social media and everywhere, but it's still misunderstood at the gist of it is that cancer is a metabolic disease. I just think it's still just the concept is misunderstood.
Mm.
And its survival just depends on its fuel and its environment. That's one of the main things. I think cancer is intelligent, and I think it's important for us to not sit back and think we've got this figured out. I think it's going to find a way to continue to be, and that we need to find a way to continue to learn from that. And I think that's how I feel about that. And maybe most important is that cancer is not you, right? You have cancer. It's not an identity. It's a process.
Definitely. Yeah. Thank you. I agree. I mean, I'm really trying to, from my chair, I'm trying to like separate it from me and not embodying it. I don't even like saying the word out loud about myself. And I don't know if that's a protective mechanism or defensive mechanism or reminding myself that I am whole as I am. And this is just part, this is like a chapter in the book. But I think that's a really good point, especially about it being, I guess the word like I took from what you just said is like kind of sneaky and clever. I'm totally paraphrasing. I don't know if you're familiar with Zach Bush. I think he was in the conventional world, and I've heard like so many snippets of interviews from him. And so I'm totally paraphrasing, but he kind of explained the cancering process. And I listened to it at the time and it stuck with me. And now I'm not going to do a good job at reverbalizing it. But he was like, if you can imagine a cancer cell in your body, I mean, we all have cancer cells in our body, right? It's our immune system's job to get rid of them. But as like a lonely cell in your system, not realizing that like there's a whole body around it encompassing. And so its job in its mind is to stay alive. And so to stay alive, it gets kind of hoggy as to how it brings fuel into its body, and then it replicates and multiplies in order to stay alive. Like this is like it's trying to survive. It's not, he said it so beautifully. It made me picture this cancer cell as like this little lonely thing, just not realizing that there's like love all around it. And so for me, when I listened to it at the time and it all made sense and I heard everything he said, it really got me talking to my body and talking to the tumor, which may not sound crazy to you, but may sound crazy to some of the people listening to this. It's like, there's so much of a fight mentality, and like, going to war with your body is what that terminology feels like to me. So it's like reminding even those tumor cells that like you can heal, and you can like, you're just a little confused right now. Like we can get back to a state of health. And I think that is why it's really interesting and resonating with me to understand the idea of it as a metabolic disease, because then we are recognizing there's so many things that we can do from all the different terrains involved. As you so eloquently explained, there's different areas to look at and uncover and correct.
I think I saw that clip. I don't know.
Yeah.
Maybe a reel. I didn't see the whole thing.
Yeah.
Yeah.
Yeah. It really struck me because it was just such a different perspective on it that it stopped me in my tracks and it made me think about it.
Yeah. I was thinking it's like the epitome maybe of isolation, but also selfishness.
Yeah. Yes.
Nobody else exists.
Yep.
No one
Exactly. Right. That is very true. So just to wrap, one question that I ask all my guests, you're on the Forward Think Tank. So what keeps you moving forward in life, in your career, maybe in both?
It's my purpose. It's just why I'm here. Like there is nothing more impressive or more in depth, I think, that I can say. There's nothing more in depth that I feel about it. I think I was put here for this. I know I'm walking the path that I'm supposed to be. And that's just purpose.
I agree with that. I'm like, oh God, like all these questions, sometimes I get so emotional, but obviously knowing how much you've helped me. And like I said, these conversations that are can feel so heavy depending on what doctor I'm talking to. And also the energy that they come at with these conversations. I've felt so taken care of by you. So I agree with that. I do think you've been such a gift to me, and I'm sure like such a gift to this world that you were, as you explained from the beginning, so hesitant to step into. And probably because you're so intelligent, you wanted to make sure that you had the right tools and the right information and the right learnings and understanding of it all, as complex as it is. You know, it's obviously not a fun spot to be in from a patient lens, but I'm trying to make the most of it and ask myself what I can learn from it every day.
Yeah.
So to have you as my resource, to have you as like the guiding light and making the roadmap with me, you know, it's definitely something that we have very fluid conversations about when we do meet. I agree with that wholeheartedly. I think you're in the right place, and I think I know you're making a difference in my life, so I'm sure you're making a difference in countless others.
And then it's well worth it. It's well worth it then. So thank you.
Of course. Thank you. I will absolutely make sure that we link your website and all the ways to get in touch with you. I am so grateful to have you on the podcast. And this is actually the last episode of season 1, if you will, before we move into surgery, and we will come back, you know, I'm sure a lot of lessons learned and a bit stronger.
Yeah.
Hopefully we'll get there. But I think this is a really great conversation to wrap this season, because I have learned so much from you, and I'm sure that learning will only continue.
And same goes. You are an inspiration. You're an inspiration to me.
Thank
and
you.
to many. And
Thank
you. I love how you are using not just a diagnosis, but where you are and your presence here to educate, to be there, to encourage, and to love. And I think that's sort of, if we can say cancer brings gift, that's the gift you're giving because of this. And I think
Yeah. Thank you. I think it helps the healing process for sure. I can't explain, you know, the overwhelming feeling of how many wonderful people have come into my life, you know, even outside of the practitioners, patients who have either worked with you, worked with Lori, worked with Dr. Nasha, or have not had that experience at all and are really looking for resources. I've gotten so many questions since putting my story out there, but I think it's helping me realize that I'm not alone and that I need to lean on my support system. And I really do. I want this to be a place where people can learn and get some out of the norm or outside of like conventional approaches to healing, because I think there's so many different ways that we heal. And so by sharing conversations like this, conversations with people who are on the other side of the healing journey, or even just people who are doing some really cool things in the world of wellness, I'm just hoping this can be a platform to continue to inspire people. So thank you for being a part of it.
oh, you're welcome. It's my honor.
Thank you.